Welcome to another episode of Scoliosis Dialogues, the official podcast of the Scoliosis Research Society. I'm Ron El-Hawary from Boston Children's Hospital and the current chair of the Scoliosis Research Society's Communication Council. For nearly 60 years, the Scoliosis Research Society has been a global leader in spinal deformity research and education. But as we look towards the future, the Society recognized the need to formally nurture the next generation of leadership. That vision led to the creation of the SRS L.E.A.D program, which stands for Leadership, Education, and Development. Today, we're diving into what makes the program unique and how it's shaping the surgeons who will lead our field into the decades to come. Joining me are three distinguished surgeons who have been deeply involved in this journey. Dr. Noelle Larson, Chair of the Division of Pediatric Orthopedics at the Mayo Clinic and a member of the L.E.A.D cohort from 2024-25. Dr. Chris Hardesty, Professor at Rainbow Babies and Children's Hospital and a graduate of the inaugural L.E.A.D cohort in 2023-24. And Mr. Morgan Jones, Consultant Spinal Surgeon from Birmingham at the Royal Orthopedic Hospital, representing our international commitment to leadership development. Drs. Larson, Hardesty, and Mr. Jones, welcome to the program. So, first of all, the why. Chris, as part of the inaugural cohort, let's start with you. We spend years learning the technical nuances of a pedicle screw or how to do surgery such as vertebral body tethering. Why does a spine surgeon specifically need leadership training?
Thanks for that question, Ron, and thanks for having us on the podcast. I don't think any of us puts in a pedicle screw or takes care of a patient or develops this future of research in a vacuum. So we're doing all of these things as parts of teams, and inherently as surgeons, whether or not we want it, we are leaders. People expect us to be leaders in the operating room, in our clinics, in our hospitals. They just sort of naturally expect us to step up into those roles. And having the teaching of L.E.A.D and the opportunity to learn all of these lessons about culture development and about choosing the right people for your teams not only helps us in taking good care of patients in the operating room and in our own divisions, but it also develops the future of the SRS. So the SRS has really set itself up for success in the future by creating leaders through the L.E.A.D program, but it also has created these opportunities where we get to know one another in a less formal educational setting before we're set up to be leaders of SRS in the future. I think the generation before us, you guys met each other often at the time you were put into leadership positions. We'll have the advantage of really developing a network and a community before we get to those positions, which I hope will create a better culture and set us up for even more success in the future.
Yeah, those connections are key, and I think the earlier you develop them, especially if you're traveling through the years in different leadership positions in a society such as SRS, I think it's really important to cultivate them, not just locally or nationally, but internationally as well. Okay, speaking of international, Morgan, the Scoliosis Research Society is an international society. From your perspective at the Royal Orthopedic Hospital, how does the L.E.A.D curriculum translate across different healthcare systems like the NHS in the UK versus the American model?
Well, thank you again for having me, Ron, and it's a pleasure to be in such esteemed company. And one of the things that the L.E.A.D program is exposing me to is the ability to meet and interact with people from all different areas of the globe and different working in different healthcare environments. So on the L.E.A.D program at the moment, we've got guys from India, from Europe, from UK, and then across from the States. And what you are able to understand as part of the journey of the education program is that many of the fundamentals of leadership, when they're stripped down, are translatable across all of these different healthcare systems. So in the UK, the system may be different in some ways to the States. We perhaps are more explicitly resource constrained, and we've got actual different challenges. But in order to deliver the best care for the patient, the fundamentals of teamwork, offering a clear purpose and a clarity of vision, and those skills, the soft skills that are not just about putting in a pedicle screw, are exceptionally important. You know, as we go through this journey of being a resident through to early years consultant surgeon, or in the States probably attending through to a more senior, you know, professors and associate professors, you're taking on different roles, but there's leadership at every step of that journey. And the challenges, I was talking to Cal Illingworth, who's also on the leadership program, and the challenges that you have at the different stages of your career, because we're sort of slightly similar levels, they resonate across all these different healthcare systems, you know. And then as you go further up the system in terms of more seniority, you're offering a different vision, but the leadership skills are consistent. It's about getting people to buy into the culture, learning what the vision is, trying to go in the same direction. And then we're here as a group of different people who haven't been through the program, but it's clear that one of the first things you said was culture. And it is about that. The SRS offers a culture of practice, a culture of thinking, a community of knowledge that we all want to be a part of. And it's funny because I don't know if you've noticed this as you're going through the program, that we probably share similar leadership styles. I've found that in our group we have quite similar leadership styles. So you have, you know, collaborative leaders or sort of autocratic leaders, but actually the groups that I'm exposed to here, it seems to be quite collaborative. They seem to be looking at how to get people to buy into, and then join them on a journey of change, or delivering amazing care, or learning new things and really changing the way that people think about the world. So sometimes it may seem a little bit corny to say these things, but actually when you start to buy into it and you start to read into it and you start to become part of that process, you realize that these things are really important, and actually the high level thinking is super valuable. So those cross-cultural differences are not that different. You know, the environment you work in is just different, and the challenges may be different, but being able to adapt to the challenges, the strategic leadership teaching that we get is helping you to understand what the actual challenges are and how to navigate it effectively, you know, and executing your plan. There was a great talk from some of the guys in industry yesterday. We had some real, you know, leaders in industry coming down from Higher Edge and Medtronic, and they were talking about executing your plans, you know, as part of your journey of being a leader. And these are things that actually you know that you need to do it, but then sitting there reflecting on it and you know, more formally recognizing that as a step in the process of change is pretty good, I'll be honest.
Yeah, it's amazing to hear your perspective as an international member of SRS. And, you know, part of our mission and our vision is to be a global leader in the care of patients with scoliosis and other spinal conditions. And as we do, it's important to learn the perspective from our international members. And it's refreshing to hear that perspective, that there's a lot of commonalities over time. And I think this program, as you've stated, really brings people together. And you'll be working together for many years to come. Noelle, I'm going to shift gears a little bit more about the curriculum. You know, there's lots about how to be a leader, what type of leader you are. And the curriculum itself covers everything from communication to wellness and diversity. Is there a specific aha moment or a particular module that has already changed how you manage your team at the Mayo Clinic?
Oh, thank you, Ron, and it's great to be here in such illustrious company. I would state the underlying premise of LEAD is leadership is a skill. And just like we teach someone to put in a pedicle screw or teach our residents how to bend rods and cut rods, we can become teachers and learners and connoisseurs of leadership pearls. And just like surgery is something that's not learned in a day and it's not learned in a quarter, it's learned in a lifetime, I think leadership is similar, where it's a skill where you can continue to evaluate your performance on a daily basis, look back and see how you do. And for surgery, you know, we look at x-rays and we look at patient outcomes, but for leadership, we can really have to and this is some of the talks we heard through our curriculum at LEAD, for leadership, we have to be self-reflective and willing to take feedback and critique from our colleagues. So one thing I've added to my OR team is that, we brief before the case. The patient comes in the room at 7:30 and we brief at 7:15 and talk about the equipment and the perioperative plan. But I've really tried to do that post-brief with more regularity, and not only have the surgical plan in the post-briefing, but also include communication and leadership. So what were the instances in the case where we asked for something and we didn't have good communication, or we didn't have it on hand, or how did we interact with the team who was covering for lunch? Did that person not understand the case, and could we have improved the sign out? So I think this communication piece and the continuous reflection on how your day went, how your interactions went, and how can we grow together as a team, that's something that I learned from the LEAD curriculum and has really made a huge difference in my OR.
Yeah, it's really a continuous process, isn't it, of self-reflection, learning about yourself, learning about your team, thinking about how you can improve and change, and then going through that cycle over and over again until your team improves and you become a better leader and a better person. I'll ask you real quick, and then we'll shift back over to Mr. Jones. Do you think there are any natural born leaders? Is that a thing, or do you think it's a skill that anybody can learn and develop?
I think we need to disrupt that thinking that leadership or surgery or mathematical skill, that all these things are genetics. And instead, it's really deliberative practice. And so I think leadership is a skill as well. And we learned in LEAD, lots of different types of leaders out there. If you cut out all the introverts, you're going to be at a loss. And there's lots of different ways to be a leader. But understanding your skills and having, again, iterative feedback, being willing to hear the feedback when you're so lucky as to get it. This is how we make progress forward as being good leaders.
Yeah, you have to be open and receptive to feedback. You want to have to hear it, and you want to act on it to become a better person and a better leader.
And damn, that's hard.
It can be, yeah.
Can I add to that? I mean, one of the things that I definitely have taken from going on this LEAD program is there are processes that you can put yourself through to try and improve how good you are at being a leader, but also by reflecting on having witnessed bad leadership, having witnessed good leadership, what you can take from that. Yeah, so being more self-aware about how you impact those around you in an operating room, even if it's a resident, through to the rest of the team, and how small things you do will impact them to be better and also make them perform less effectively. Clarity in roles is another really clear thing, really valuable thing that I've learned from a lot of this leadership training, is that if you are not clear in what you want from your team, they don't perform as well, and then you don't perform as well. So there's all these reflective processes that you can go through which improve how both you are as a leader can perform, but actually getting the OR team to do, in England we call it the theatre team, but the OR team to perform really well is paramount to good performance. So.
Just one more thing to add, because you asked Noelle about features of the program that were particularly meaningful. And we read 5 books that I would not have otherwise read. And I took something unique away from each book that I not only internalized, but for several of the books turned around and did exercises with or applied to my teams that I work with at the hospital. And we've all changed for the better. So those books alone were an invaluable part of the LEAD experience.
Yeah, it really forces you to do some extra reading you might not have otherwise done, and to learn from it. One of the major themes of LEAD is owning your leadership. And I've been a mentor in this program for the last couple of years, and I've learned a lot from the program. It's probably more than I've given. When I think about mentorship, that's more about guidance. I think what the society, the Scoliosis Research Society, tries to strive a little bit towards is not just that guidance or mentorship, it's sponsorship, which is advocating for the younger members of the group to help you reach your goals, get your leadership positions you want, and help kind of cultivate your career. Chris, have you ever thought about that difference in mentorship and sponsorship? Or if not, maybe describe some of the mentors you've had over the years.
I think about it all the time. And from the perspective that, I've been the beneficiary of really excellent promotion, not just mentorship. I've had someone in my career, I'll just name him George Thompson, who didn't just help me figure out where to go, he actually pushed me there, right? And he set me up for opportunities. And so I think about that constantly in terms of how I help my residents, our fellows, how I help people that I'm working with through societies like the SRS, how we as now colleagues and friends through programs like LEAD help each other. You know, when we're part of, say, the program for another meeting, I might call up Noelle and go, Noelle, I think you're absolutely the right person for this talk we have to give. And that helps me put on a better talk, but it also helps develop Noelle's career by advancing her. Those are essential qualities of this program. And LEAD does that very well. That's a transition in the society from being a general either candidate or early active member where you're making friends and you're developing your career, you're maybe joining committees, but it's a catapult forward when you get to the point where promotion is happening. Not just mentorship, but sponsorship.
Right. Noelle, how about you? Tell us about your experience with mentors or sponsors. How have those other members of the society, of the SRS, helped you out through your career?
Oh, I mean, that's a huge, long list, and many folks who've been instrumental, probably starting with Dave Pauly and Peter Newton and many colleagues. I'd say from the LEAD experience, I was made to feel so special from like day one. Again, as part of LEAD, they literally put your name on the wall with your picture at the entryway to the meeting. It's almost embarrassing. You feel a little bit like royalty. But it is true that our future is the young people, the future of the society. And if anything we're ever going to do, succession planning and bringing up young leaders to help us in the future, like what could be more important for a societal activity? And the opportunity to network with peers, network with current leadership, meet industry partners, and suddenly be on a first name basis with 40 people is unbelievable. So I mean, I think SRS, Dr. who is one of the supporters of this program, I mean, it makes me so proud to be an SRS member and so proud of the work of LEAD because we are training up the next generation. Not just from your own center, not just from your residency program or your fellowship, not just from your country, but training leaders from around the world to take care of scoliosis patients globally.
It's a real commitment from the Scoliosis Research Society leadership. You'd mentioned Serena who had helped create the LEAD program along with Laurel Blakemore and Todd Albert, had been very instrumental. 3 former presidents of the Scoliosis Research Society. The 3 mentors that you had mentioned, all former presidents of the society, Peter Newton, David Pauly, and George Thompson. So it really gives a lot of evidence to how the leadership of SRS is committed to fostering the development of younger surgeons. Noelle, you can add to the list?
Just a shout out to Dr. Who as well, because she was my mentor and sponsor over the LEAD program, and she's amazing.
She really is. Morgan?
Well, I was going to say exactly reflect what I'd shared by you two guys, is that, you know, I wouldn't even have engaged with the SRS were it not for my mentors, as Dave Marks and Joanna Matter, and I barely even knew it existed before going into my residency training. And then you discover this incredible community of practice of really special, really gifted surgeons who are setting themselves quite challenging tasks. Like, what is the problem here, you know, with scoliosis? How do we solve these really challenging problems that we have in an OR? And then to be introduced to that, and then you can continue to grow as a professional. Basically, the more you engage with this incredible society, with all these very special, very gifted, really, you know, empathic human beings, is a real privilege. And then, interestingly, as part of the LEAD program, you get paired with a mentor. So I'm paired with Dave Skaggs, and Dr. Skaggs is talking about, you know, at some point as the mentor, you start to get feedback from the person you're menteeing, and that in turn is also a journey of like learning, reflecting, and so it never really ends. Yeah, and that's a real privilege, you know.
Yeah, privilege. That's a good term for what it is, and it obviously goes both ways through the society, that the mentor and the mentees. Okay, so Chris Hardesty, you've hosted this podcast many times in the past, and I like when you come to the close of a podcast, you do a lightning round.
Oh
so
boy,
question,
here we go.
And it's not just a one-word answer, but it's, summarize, 15 or 20 seconds. And the question is, and it'll go to each of you. So if a candidate member of the Scoliosis Research Society or a young member is listening and thinking about applying to the LEAD program, what's one soft skill that they should expect to work on that they might not realize is crucial for their career?
I am working on being a better listener. And I'm trying to pause like 15 seconds before I say something and really listen to what the person said before I speak. And I've learned that at LEAD.
Wow. Well, Noelle, I've known you for about 20 years, and you've always been an exceptional listener. So if you're getting better, kudos to you. Morgan.
So there's a range of things, but I think there's two key themes. One is that ability to listen and reflect what is being said to you back to the person that you're interacting with. So it gives you a much richer kind of deeper understanding of the communication. So listening is clearly a key soft skill that comes up all the time with the kind of leadership discussions. But the other is I actively want to get more feedback. Yeah, I want people to tell me when I'm doing stuff badly. Yeah, because actually that's my weakness. I'm like, what am I doing badly? Tell me how to get better. Yeah. So trying to get active feedback about where you are performing poorly and being much more open and receptive to that, I think is a really key component of getting better. Being better at what you want to do, and working better as a team. So
yeah. Listening definitely is a skill, and that active listening, reflecting, hearing what the person is saying, all traits that we should continue to work on.
So I think the biggest soft skill that I've had to work on developing is networking, because I'm terrible at networking. And it pushed me not only to get better at interacting with colleagues in a social setting, but it also gave me a chance to learn skills at interacting with industry, because industry has contributed so much to this program. And we really owe a debt of gratitude to our industry partners for their contributions to it, both financially, but also for helping us better understand how the relationship with them benefits both of us.
Well said, guys. All right. And now before the ending, we can do something fun. It's going to be, the lightning round was fun, Chris. Great idea. I loved it. Great answers all around. The question is, one fun moment, memorable moment you've had during your LEAD program.
Well, we were in Glasgow at IMAST last year, and we were all together, and we were walking in the doors of the Royal College of Surgeons with a gentleman, a very large gentleman, in a kilt, playing the bagpipe. And we felt very special and loved and dedicated to our future career at SRS. So thank you, LEAD, for now and the future.
Nothing like a good bagpipe tune. That's
awesome. It was
awesome.
loud. It was really
bet.
loud.
How about you, Morgan?
Well, I think some of the best moments on the LEAD program are just the informal social side of talking around your difficulties, what's going on in your career at that time with other people who are on the same journey, often at the same point in their career, and seeing that you have commonalities but also differences in the challenges, and then sharing some social time. We went on a food excursion into the food market here in Toronto, and I have never eaten so much food. It was like we then had the LEAD session in the afternoon, and everybody was very postprandial.
Oh man!
And I had some of the most delicious seafood chowder thing I've ever eaten before. That was great. So yeah, the social things are really nice because actually you get to spend a bit of quality time really with people who are also on the course, and they're often really interesting, surgeons.
The inaugural cohort got put out on a boat. So they put us all together in one space, pulled us out into the harbor and said, now you can't go anywhere. You have to talk to one another, which was a really actually wonderful and fun experience.
It's clear that the LEAD program is more than just titles. It's about building a sustainable culture of excellence within the Scoliosis Research Society. I want to thank Dr. Noelle Larson, Dr. Chris Hardesty, and Mr. Morgan Jones for sharing their time and their insights today. If you are a Scoliosis Research Society member interested in the LEAD program, I highly encourage you to visit the SRS website at srs.org to view the current cohort and learn about upcoming application cycles. Thank you for listening to Scoliosis Dialogues. Don't forget to subscribe on your favorite podcast platform, and we'll see you in the next episode. I'm Ron El-Hawary, and on behalf of the Communications Council of the SRS, thank you for all you do for patients with spinal deformities.